The stopcock must be in the off position when the patient is not getting medications or feeds. This is off to the patient. This way is also off to the feeding. So wherever it's pointing to off is the area that's off. However, when you're giving medications or feeds, the off must be to where you're not using that port. So if I'm using the feeding port, it's now opened, so the feeding would be going through the port and into the patient. If I'm giving meds, I would turn it off to the feeding port because I would be giving meds through here, and as the arrows show, the feeding would be going through and into the patient. When you're done giving meds or feeds, you would always want to turn it off to the patient. Therefore, none of the stomach content would be lost. This video will demonstrate the procedure for administering enteral meds and feeds via a PEG tube. The nurse will be administering 0900 meds and feeds to Sally Wright in 205 door. The nurse will first complete hand hygiene. She will then get the correct chart from the chart rack in order to check the doctor's medication orders against the orders in the Medication Administration Record, or MAR. The procedure for checking medications and pulling out medications from the Pyxis is the same as oral medications. Please see the oral meds video. All medication have been pulled. The first and second check have been completed. The nurse puts the medications in a drawer. Never leave the medication on top of the WOW. Minimize the screen before leaving the med room. Leaving the screen open is a violation of the HIPAA law, which protects the patient's privacy. The nurse is now ready to go to the supply room to obtain the correct formula for the PEG feeding. Open the MAR screen and compare the correct formula, Ensure, with the MAR. Also check the can for an expiration date. Other supplies you must take with you are a feeding bag and a pH strip. The water container and a piston syringe with the irrigation kit will be at the bedside. Other supplies needed are your goggles, clean gloves. The pill crusher will be on the WOW. Minimize the screen before leaving the supply room. In the patient's room, the nurse will perform hand hygiene and open the MAR screen. She will identify herself to the patient and ID the patient.
Good morning, my name is Sharon Pulano. I'm a student nurse from NCCC. I'm here to give you your 9 a.m. medications and your 9 a.m. feeding. Can you please tell me your name?
Sally Wright.
Date of birth?
5/27/1950.
Any allergies?
No, I do not.
Good.
Check the MAR screen and make sure that the cursor is in the upper left-hand corner and highlighted before scanning the bracelet.
Can I see your bracelet, please?
Once scanning, the word no changes to yes. This lets you know that you have the correct patient. Elevate the bed at least 30 degrees. This must be done prior to accessing the PEG tube to prevent aspiration of medications or tubing. Put on clean gloves and goggles. This must be done prior to accessing the tube for standard precautions. The stopcock must be in closed or off position when not in use. The stopcock must be in open position when checking for placement, administering medication, and flushing with water. The next step is to assess for tube placement in the stomach cavity prior to administering meds and or feeds. Clean gloves are on. Put 10 milliliters of air into the piston syringe and attach the syringe to the Lopez valve. Open the stopcock to the patient. The nurse inserts 10 milliliters of air into the tube and auscultates using a stethoscope over the left upper quadrant of the abdomen for a swishing sound. Immediately, without removing the syringe, aspirate the stomach content. Return all stomach content except for 5 milliliters. Close the PEG tube to off position and remove the syringe. Use this amount to check for pH with the pH strip. The meds and feedings may be given if the pH is 5 or less, signifying that the tube is in the stomach cavity. Remove gloves. Perform any other assessments needed prior to giving the medication. If you are giving DIG, you must check an apical pulse for 1 minute and hold if it is less than 60 beats per minute. Now that the nurse has completed these assessments, the patient may have the medication administered. Fill the graduate with 200 milliliters. This will help with dissolving and flushing the medications. This amount is used to assist with calculation of intake. Complete the third check of medications by scanning each med. Be sure that the box is highlighted correctly. All medications must be crushed separately. The nurse crushes each of the meds separately and pours enough water to cover the level of the medication. Remember to review meds that can't be crushed, for example, enteric-coated medication and time-release pills. Never crush a capsule. If it is unbanded, it may be opened and added to water. A banded capsule cannot be crushed. Then pour liquid meds. Prior to administering medications through the PEG tube, the tube must be flushed with 30 milliliters of water. Be sure goggles and gloves are on before accessing tube to prevent splashing into eyes. Remove the piston from the syringe. Attach the syringe into the end of the PEG tube and pour 30 milliliters of water into the syringe. Open the stopcock. Allow the water to flow into the tube by gravity. Administer medications into the syringe, allowing them to flow by gravity, but do not pour medications into the mannequins in the lab. Administer 10 milliliters of water between crushed meds and liquid meds. After all the medications are administered, then flush the tube with 30 milliliters of water. Close the stopcock to the off position. Remove gloves and goggles. Perform hand hygiene. Complete documentation of all medications and signature at the bottom of the page with the time 0900, signature Sharon Polano, SN/NCCC/SP to identify your initials.